Hello, this is Dr. Do again. This video is still on alphabetic list of problems on letter M. And today I'm going to talk about a disease called multiple myeloma, which is usually occurred in older people. It is associated with one of the blood cell, lymphocytes, B cells of abnormality. It's a malignant. Basically affect the B cells from the bone marrow. Actually, this multiple myeloma actually served significance beyond the clinical diagnosis, beyond the clinical, I don't know how to put it, because this is the first disease associated with the theory called double genetic hit theory. So this disease is so significant in the medical field, in the medicine, in the research or clinic, and genetics. Because when I talk about this, so it's everywhere in the exam or the clinical. It's really widely discussed. In terms of the patient, they're quite population, the incidence rate is not very low, and it's quite common in older people, and the presentation could be subtle and sometimes just chronic, even though it's called acute multiple myeloma, but the process is really, since it's subtle, so it's the symptoms, the clinical presentation is not typical. There's a bone pain or abnormal kidney renal function test or infections. So basically, in terms of whether there's any associated emergency with this multiple myeloma, probably there are some undiagnosed or diagnosed without treatment, without the remission, and then causing the kidney damage, especially the kidney stone, bilateral kidney stone causes the emergency usually. If one time, one side of kidney stone, probably not that emergency, but still kidney stones, clinical-wise, it's quite painful if they're stuck in the tubule. Also can have the recurrent infections and the bone pain. So these are just the very subtle clinical symptoms, but some of them could really involve emergency. You have to see the emergency department to get those, for example, the kidney stone clear out and the bone pain managed and the infection. So since this disease is really associated with the theory, so let me just explain what is that double hit theory. Because in order to have this multiple myeloma, it has to be two alleles affected, undergoing the mutation. We know the genetic disease, there's a somatic dominant or somatic recessive in terms of the genetic theory. But so for the somatic dominant disease, just one gene, one allele is affected, then will have the phenotype. And for the recessive, have to have the two alleles affected, and then in order to have the phenotype. So this multiple myeloma is similar idea as the recessive. However, it is not genetic. It's a mutation. So it has to have the two alleles mutate into the disease, the gene, in order to have the phenotype, in order to have the disease of this multiple myeloma. Okay, so this is one of the significance of this disease, because this new theory of the non-inherited disease will have to have two alleles undergoing the mutation to have the clinical significance, clinical manifestations. And the other significance of this disease is because it is associated with the B lymphocytes. If you recall, the lymphocytes are different types of T cells, B cells, and other natural killing cells, for example. And the T cells are briefly responsible for the cellular immunity, different T4, T8, helper memory. For example, those are the T cells function. And the B cells are are the lymphocytes responsible for producing antibody when we have to deal with the infections, for example. And this multiple myeloma is the disease of the B cell, which cannot produce normal antibody, so have the fragmented protein, the immunoglobulin, for example, to fight the infection, but this B cell cannot produce normal immunoglobulin, so has a piece of the immunoglobulin as a benzoate protein excreted from the kidney as a benzoate protein in the urinalysis. So this is another, in terms of in the medical field, another significance for this urine test. Instead of regular urine test, and they use the special test to detect this benzoate protein. So these are really the theoretically for medical field for the physicians. And in terms of patient, my video, how is this video to help you if you're a patient with this multiple myeloma? What are the signs you're looking for? First of all, it usually occur in older people, and secondly, like I said, the symptoms are quite subtle. Bone pain, feel tired, look pale. So this is probably the general presentation. Of course, or losing weight, and this is the other presentation. Or sometimes you just have frequently occurred infections without doing the thorough test, just the infections one on top of the other, one just recover, the other one's coming again. So this is the clinical significance. And also some people might have just the kidney stone in the older people, never had it before. You're doing the normal activity, you do not like the marathon runner after run miles and miles without drinking fluid, but your activity is normal, drinking fluid normal, but still have this kidney stones. So if that's the case, you probably need to see your physician to discuss this. Usually, so this is about the clinical picture of this multiple myeloma. In terms of treatment, of course, I have to supervise by the physician specialist, the hematologist, oncology hematologist to manage this. In terms of diagnosis, I already mentioned the genetic test for the alleles, and also the urine test for the benzoate protein to identify. It's quite specific. And so this is about another just like introduce a concept for this multiple myeloma, since it's quite common, and also the lymphocytes, B cells and T cells, what the function of each cells, and also the theory, the clinical significance, or the significance of this disease in terms of, in the medical field, in the clinical diagnosis, or the genetic idea, the gene mutation, double hit theory. So this is I think it's kind of, I did not have any preparation for this video, because I just sit here and think about this disease. Anyway, I hope it helps. At least you can catch some terms, and if you're interested, you can search. You will definitely find a lot of significant or interesting concept associated with this multiple myeloma. I'm going to stop here, and I hope it helps. And thank you for watching. I will see you next time.